In the last few minutes, vaccinated passengers travelling into the country could no longer require a negative PCR or antigen under plans being considered by ministers at Cabinet at the moment. Since December, due to concerns over Omicron, all arriving passengers have needed to get either negative PCR or antigen regardless of their vaccination status. For reaction to this, I'm joined now by Eoghan Corry, editor of Air and Travel magazine. Good morning, Eoghan. How significant a change do you think this is going to be?
It's very significant. The measure was introduced in December when there was a great deal of worry and not much certainty about Omicron. The first country to introduce restrictions for travel within the European Union was Portugal, and we followed a day later. As it happens, very few countries followed. I think Italy, Greece and Cyprus introduced some measure of testing for travel within the European Union, and as of tomorrow, tests will no longer be required. But it's really important to emphasise, Philip, we're only talking about travel within the European Union, because this has been really the programme that was brought in at European level since July with the European Digital Certificate, is to treat travel within the European Union as if it was within one country.
And Eoghan, do you have any idea why this move is being taken now? Were cases just not being caught by the antigen and PCR requirement?
You can see right across Europe that there was a great deal of uncertainty about Omicron, and it's now abated a bit. Germany lifted its restrictions on British travellers yesterday. The cases, as we know, are running away. Our 14-day cumulative is something around 4,000 at the moment. But the measure to require passengers to test before they travel, only a couple of countries introduced it, and those that did are now looking at it. As they are looking at it, it's part of the same narrative as reducing the isolation period.
No, I understand that, but you don't know if this decision is being taken on public health or epidemiological advice, or as a result of an airline commercial imperative.
No, nothing has happened as a result of an airline commercial imperative from the start of this. The airlines have been throwing their head, they've been quite frustrated. But what we did see, and this was a big shift, Philip, from July, was that the definition of risk was transferred from the country of origin to vaccination status. Remember, this applies to people who are fully vaccinated. And that has been, that sort of emphasis, that sort of change, switch of emphasis has been something that was led by Europe, and all of the 27 countries followed on despite some local pressures, and we also had our local pressures and local dissensions about it.
Eoghan, has a decision been made yet at European level about whether COVID digital certificates should be issued for boosters?
Now, this is a big running story at the moment. As of January the 17th, France will require evidence of your booster on your QR code, the QR code that everybody has for their European Digital Certificate. All Irish people have at the moment is a little slip of paper about half the size of the original vaccine cert, and it's not on the QR code, nor are there plans to introduce it. What we will see probably in the coming weeks is more countries following France. Spain is likely to follow on February the 1st, and this could create problems. But the technology is there, the record of everybody's booster is somewhere in a system, and it's just a matter of marrying it up with the information on the QR code.
Are we unique in this, Eoghan? I mean, or is it the case in Germany, in Sweden, elsewhere, that boosters haven't yet been translated into QR codes?
And there are other countries that have slower technology than the big ones like France and Germany. But it is the next tripwire, the next little bit of hassle which comes to travel, and not just travel, also admission to, for instance, Disneyland in Paris is requiring your evidence of your booster on your QR code, and we've had people at Christmas markets before Christmas in Germany many who were refused admission because there was no evidence of the booster. What we've seen at European level is an acceptance that there's a sell-by date on the second vaccine. A lot of Irish people got the second vaccine June, July. That means around Patrick's Day, countries will start looking for that evidence of that booster. The facility to put it in, the joy of the QR code is the QR code doesn't have to be updated. The information just has to be added to it.
Big picture here, Eoin. What has Omicron done to demand for flights and hotels?
It's a very slow time of the year for travel. What it's done has been affected the supply side, Philip. A lot of flight cancellations. They weren't huge by numbers because an ice storm would cancel more flights than we saw cancelled by Omicron. But for instance, Ryanair have pared back their January schedules by about 30%. They haven't done anything with February or March yet. But what airlines are looking at is something quite new and unexpected in that the COVID-affected staff is beginning to impact on schedules, the same as we've seen on bus and train services. And nobody's quite sure where that ball is going to bounce next.
No, indeed. All right. Eoghan Corry, thank you very much. Dr. Maura Finn coming up after this break.
Today with Claire Byrne. Listen back on the RTE Radio Player app.